Good evening, Dr. Draper. This is David for the Leadership Design class 414. And this is the video log number 3. And looks like this week is continuing on empathy. Since the last video log, my team had another meeting, and then we had a meeting with you, and we got to hear from you quite a bit. My takeaway from the meeting was that the emphasis for the project is that everyone involved has an understanding of what type of systems are used in order to actually set up a collaborative system for teams. And I don't mean teams like Microsoft Teams, but actually like setting up a team. So that got me thinking quite a bit, but that's something that I'll have to continue to see if we can pull out another system we can use in order to collaborate better. But hopefully everything's going well with all the other teams and them setting up everything for their prototype bag design. But one thing was, and I guess we're into we're getting deeper into the research portion of the curriculum. So the majority of what I wanted to talk about for this video was actually the video with Dr. Scott Kruger. I just got done watching that, and about mantle cell lymphoma, and Dr. Kruger gave an overview of what it was, and some of it was over my head, but he did a very good job of explaining. He reminds me of a family friend that talks the same way, and seems like a very amiable person, easy person to talk to and get along with and everything. Seems like a great doctor. But my takeaway from it, as far as our curriculum, is I just kind of wanted to put his story into my own words, and that is that Dr. Kruger came from a family where his step-grandfather had multiple myeloma, and he shared a story about that. But it reminded me of a character in a TV show that I saw, and they had the exact opposite. In case they had the exact opposite relationship. He had a very loving relationship with his family, so that made getting over cancer a lot easier. But his grandfather ended up dying peacefully at home with his whole family around him, and he didn't talk too much about the morbid and the morbid parts about it, about chemotherapy and how rough and rigorous it is. He gets into that when he's talking about one of the patients, the John Doe. But one of the things with when he talked about his step-grandfather, he said that my takeaway from it was that because they communicated a lot about cancer and just the implications of it with the family and loved ones, is that it kind of normalized it and made it in the social environment that he was in. So that was my takeaway from that. Normalizing terminal illnesses, and not all types of cancer or terminal illnesses. Most of them can have a pretty good prognosis. I'm glad that the John Doe ends up having a pretty good prognosis until the cancer ends up coming back, or, well, it's laid dormant in his brain. But normalizing it is part of getting awareness, where it's not hush hush. And people can't talk about it. So I think it's a good place to start with empathy, and you can't have empathy without awareness. And learning, I think, is a journey. I think that learning is a journey, and it's almost as if like information shines lights on things you didn't know existed before. Like like if you're in a dark cave or something, and um, uh, it's really scary. But if you have light, a good light source, then it's not so scary. But Dr. Kruger went on a story where he talked about the treatment that the patient had, and it was pretty grueling. I think he said he had chemotherapy for 5.5 months, and a student asked a question, and I think he told the student that normally it's no more than 6 weeks. I may be wrong about that, but 6 weeks versus 5.5 months. That's a big difference. And so it's my mother, as I said in the last video, my mother had breast cancer, and so but her exposure was pretty small for the chemotherapy. It wasn't like an all day event like it probably was for the John Doe or for people who are very serious. But he talked about the everything that they ended up doing in order to get his he ended up doing all of these things in order to try to remedy and get rid of the cancerous infection in his blood. But yeah, he ended up going in remission. They gave him the full status of remission, and he ended up getting married and buying a house and everything like that. And everything was fine and dandy until 10 years after his treatment, when he came back with, based on the scans, it looked like it was probably about a golf ball size tumor inside of his head, with really bad symptoms. And of course, the prognosis wasn't good, but he could possibly live on. And he went through all of the treatment and stuff, and it ended up very tragic for him. But Dr. Kruger talked about all of his friends and family, and all of his coworkers. He said that he was a contractor, so he worked for some company that worked on a contract for the U.S. government, and that everyone pitched in. And so Dr. Kruger said he had never seen anybody. He had never seen like so much help and sympathy from other people. But he ended up having. They ended up, even though he died, they ended up raising a bunch of money towards the foundation. And of course, it would have brought a lot of awareness because John Doe had so many loved ones. But it's really interesting. But I really enjoyed the speech, and I'm looking forward to going forward with the class. And thank you for bringing all of this to light. And I guess I'll see you next week.